How do people know when is the right time to reintroduce sex?
I think people know it's the right time just as they know it's the right time to get back to work or back to university. Quite often it's when the acute side effects of your treatment have begun to diminish, so you don't feel so tired, your hair's grown back, you feel less nauseated, you haven't got bowel changes that you used to have. And so as your physical health improves and indeed your emotional well-being improves, you're less anxious, you're less depressed or low in mood perhaps, then your natural interest in sex begins to re-emerge, generally speaking. That often happens within the first 12 months after treatment has ended. So I would say most people attempt some form of sexual intimacy within the first 12 months after treatment. If they don't, or if they're on maintenance therapy that continues to suppress their sexual well-being, then that would be perhaps an indicator that they might want to seek some further guidance either from their treatment team or from their GP.
So reintroduction of sex can take some time. Could you go into a bit more detail about what to do if the changes are more long-term?
I think if you've got long-term changes to your sexual desire, and assuming that you've already got help in relation to getting hormone treatment, for example, if you're enabled to have hormone replacement therapy, that can help. And that would be via your GP or your treatment team. I think if it's not hormonally related, then it's quite worthwhile speaking to your GP about being referred for some sexual counselling. I think if you've got erection difficulties that are more medium or long term, then again going to speak to your treatment team or indeed going to your GP to get medication to help with sexual difficulties, particularly around being able to maintain better strength of erections can be very useful, and there's lots of medications around for that. I think for women, if it's difficulties with sexual pain, then either again HRT can be useful, vaginal moisturisers that are non-hormonal for women who are maybe not allowed HRT, they can be very useful, and using the right sort of intimate lubricant to help reduce friction during sex can be very useful. And again, that advice can come from a women's health clinic, from your treatment team, or indeed from your general practitioner.
Thank you.
You're welcome.